Welcome to your medical unit huddle for June 12th through the 19th. I'm Ricky, your nurse manager. One big thing that came out this week was the no longer doing blood pressures using the Visi device. You should have gotten an email on June 11th regarding the new plan for the blood pressure. So please make sure that you take the time to read that email. One thing I want to mention is that just because we're not doing blood pressures with the Sotera or Visi device does not mean that the patient does not get put on the Visi device. That is a non-negotiable unless the patient's absolutely refusing or they have dementia and they're pulling at cords or something like that. The patients are still being monitored on those devices for other things, and especially the most crucial vital signs that help us in early detection and identifying a patient who's declining. As we learned in our staff meeting last week, blood pressure sometimes is a last indicator of a patient decline. So again, we are not using the blood pressure feature at this time with the Sotera device. We can use it for the spot check or when you're doing that one time because we are using the cuff, but we're not using it as that continuous. So please make sure that you read that email. I don't want this video to go longer than 5 minutes like last time. So anyway, more information on that again in that email. Catheter care, please make sure that you are, 1, doing catheter care, and 2, that you are documenting catheter care under catheter care for clean, dry, and intact. Make sure that you're doing that. I think our guideline is once a day, but it doesn't hurt to do that once a shift, honestly. Couple reminders. So we got notification that the scrub stipend, hallelujah, will be coming out July 2nd. You can check the source for more information if you're curious about the amount or want more information about that. Around that time, you should be getting an email that gives you a link to the website to purchase your scrubs. So check your clutter. Sometimes that gets shoved in there. The employee voice follow-up survey is available the 15th through the 30th. So any feedback on that would be helpful. So please make sure that you're doing that. But the most important one this month for nurses is the Indian QI survey. That is now through the 28th. I also sent out an email to let you know where we're at with that survey. We're about halfway there. And remember, if we get 80%, we get cake. Cake. All right. Also, I presented the 4 pillars. I just want to make sure that you guys are really looking at it and taking the time to digest this information. So again, I'm looking at getting posters so we can put that out there, and they're just great words to live by, right? So it's helping our patients and it's helping each other. I'm going to turn it over to your nurse for any current quality patient safety concerns. And as always, I encourage you to subscribe to our MCR Medical Unit YouTube channel, and you get access to our staff meetings now, which was a great success, so check that out. And you guys have a great shift.